Supernumerary tooth is an extra tooth to the normal series and can be found in any region in the dental arch. Etiology of the supernumerary tooth is not completely understood. Various theories exist. One theory suggests that the supernumerary tooth is created of a dichotomy of the tooth bud. Another theory, which is the hyperactivity theory, which suggests that supernumeraries are formed as a result of local independent, conditioned hyperactivity of the dental lamina. Heredity may also play a role. Tuberculate supernumerary teeth. It is frequently described as barrel-shaped and may be invaginated and may contain more than one cusp or tubercle. Root formation is delayed compared to that of permanent teeth. Tuberculate are often paired and are commonly located on the palatal aspect of the central incisor, and are frequently associated with delayed eruption of the permanent teeth. You must extract the supernumerary teeth when the eruption of the permanent teeth are affected. This is a classical view of presence of supernumerary that cause delay eruption of one tooth. We did panoramic X-ray which revealed that there is radio opaque mass located under the cingulum of the upper right central incisor. Supplemented periapical film was done, revealed that there is a radio opaque mass located under the cingulum of the central incisor which caused its delayed eruption. So our diagnosis was very small odontome located in the central area, and its effect is delayed eruption of the central incisor, which needs quick intervention. So we made elliptical excision on the crest of the ridge. Through the excision we did, I insert a tweezer to remove this small odontome. This is the small odontome, contain mainly of enamel tissue as it appears in the X-ray. After that, we need to make a curettage to clean the granulation tissue to create a pathway of eruption. The next step is to be sure that there is enough space for the eruption of this central incisor. So one question here arises. The eruption of this central incisor will take time. How we are going to preserve the pathway of eruption from healing until the complete eruption of this central incisor? We construct a space maintainer for the missing tooth with acrylic post which inserted in the pathway of eruption, and every now and then we decrease this post by grinding it until the eruption of the central incisor. The aim of this action is to prevent the healing of the pathway of eruption. It took about 6 months after removal of the odontome until the complete eruption of the upper right central incisor. This is a female patient, 5 years old, came to me complaining of missing of some teeth. After doing the x-rays, we found that there are congenital missing of the upper lateral and the lower anterior teeth. And there is presence of one supernumerary, which we call it supplemental teeth because it looks like the lower central incisor. Through our treatment plan, we construct for her lower partial denture as a space maintainer for the aesthetic point of view. After 4 years, the same patient came to me with the same feature but in the permanent dentition. There are congenital missing of the permanent upper lateral incisor plus congenital missing of the lower anterior teeth. Plus there is a conical shape supernumerary in the lower central anterior teeth area. Our treatment plan is to remove the supernumerary and construct upper Howley retainer with 2 finger springs to close the diastema, and in the lower construction of a space maintainer. Another combined case of supplemental supernumerary tooth and congenital missing of lower central incisor. One of the most dramatic effects of the presence of supernumerary is the abnormal pathway of eruption of the permanent teeth. As we see here, the presence of two supernumeraries leads to abnormal pathway of eruption of the upper right central incisor. As we see here in this case, the presence of supernumerary tooth leading to abnormal pathway of eruption of 1-1. Here is another case of ectopic eruption of upper central incisor. After surgical extraction of the affected teeth, we decide to regain the space of the upper right central incisor. As you notice here that the central and lateral needs composite restoration, so we have an idea to treat this case. Our idea here in this case is to use the natural crown as a fixed space maintainer until later age change to fixed bridge or implant.